Hi, I'm Lauren Caldwell, the Director of the Children, Youth, and Families Office here at the American Psychological Association, and I'm happy to welcome Dr. Arthur Evans to speak with me today about Mental Health Awareness Month and National Children's Mental Health Awareness Day. Welcome.
Thank you. Glad to be here.
Great. So May is Mental Health Awareness Month, and I just wanted to ask you, why is it important to have a recognition month focused on mental health awareness?
Well, mental health issues affect many people. They have a big impact on our lives, and the reality is that most people who have mental health challenges won't seek out help. And so we think it's really important to raise the issue, make sure that people understand its importance in our lives, and to make sure that people understand how they can get help if they need it.
Sure. So how widespread are mental health concerns?
Well, 1 in 4 adults will have a mental health challenge. 1 in 5 children will have a mental health challenge. And over our lifetimes, half of Americans will have a mental health challenge.
So it's more widespread than people might be aware.
I think it's more widespread than most people recognize. And the thing is, we don't have the stigma associated with our physical health. If someone has a cold or a physical health condition, there's not a stigma associated with going to seek out help. But there is if someone is depressed or they're anxious or even if they have PTSD. And one of the things that I think is really important is for us to break down that stigma and to really help people to understand that this is just a part of life and that there is help and there are very effective treatments out there.
Are there particular groups who are more at risk for mental health difficulties?
Well, if you look at serious mental illnesses, the prevalences are about the same across populations and across the world. But if you look at less severe forms of mental illness, there are lots of variation, and that is really affected by social determinants like socioeconomic status. It's affected by the level of stress that a community might experience. It's affected by a number of other things that can impact on people's mental well-being. And so one of the things that we think is important is to make sure that we have strategies that are varied so that we can reach those various communities.
So May 4th is National Children's Mental Health Awareness Day. Why the specific focus on children?
Well, children, first of all, children are important, but also one of the things we know is that what happens in early childhood can have a significant impact and influence on what happens to us in adulthood. There's a study called the Adverse Childhood Experiences Study that shows that negative things that happen, whether it's a divorce or those kinds of things, when you look at the number of those kinds of events that happen in early childhood, they are directly related to negative outcomes in our health status, our mental health status, our physical health status. So we know through a lot of research that if we can intervene early, that we can really change the trajectory in children's lives and adults' lives and really improve our health outcomes and our social outcomes.
And our work with various communities has demonstrated that parents aren't always aware of this information, or neither are teachers, and it's helpful to get to shine a light on the idea that what happens early makes a difference and that adverse experiences can impact children as they're growing up. So the awareness piece makes sense.
Yeah, absolutely. I mean, one of the big challenges that most people who have mental health challenges don't seek out care. And so to the extent that we can help people recognize that these are real issues and that there is effective help, that we think that more people will access the help that they need.
So the Substance Abuse and Mental Health Services Administration has designated as their theme for National Children's Mental Health Awareness Day this year, Partnering for Help and Hope. And that really focuses on integrated care. Can you say more about what integrated care is?
Well, integrated care simply means that mental health services are integrated with physical health services, for example, in primary care settings or community health centers. And the whole idea is that because these services have historically been separated and delivered separately, that there's a recognition that if we can provide them in the same location with providers who are working together, that we can much more effectively treat the whole person. But it also is a way of reducing the stigma associated with mental health services. We know that many people are more likely to access mental health services if they're provided in that general healthcare setting as opposed to a specialty healthcare setting that's separate from the general healthcare system. So we think it's important both in providing better care but also improving access, particularly for groups that historically have not accessed mental health services.
And we see that having integrated care in settings like school-based health centers and other community-based organizations really helps provide access for children who may otherwise have difficulty getting care, and especially sometimes for teens who may need to seek services and want the confidentiality that might come from services in a school-based setting, that they may not be able to access that type of care otherwise.
Yeah, that's a great point, and I think another important group are immigrant groups who often in their countries of origin don't really even have a language for mental health services. Cambodian community, for example, doesn't have a word for mental health, and so when we're working with immigrant communities, it's really important to provide services in those integrated care settings, because that's where people are going to access their health services, and it then provides an opportunity to address the mental health needs as well.
So there's a strong message around integrated care to
Absolutely, it's very
be
important.
shared.
Very important.
And APA is doing a number of different events and activities around Mental Health Awareness Month and National Children's Mental Health Awareness Day, as you know.
Yes.
We've had a discussion on vulnerable boys and men of color, talking about specific mental health needs there. We also have a 125th anniversary discussion focused on bullying coming up, a number of different webinars, a podcast focusing on children and stress, a number of other social media activities. For a full list of activities at APA, you can go to www.apa.org and click on the news section to find the full list of events. So I want to thank you for talking with me today about Mental Health Awareness Month and National Children's Mental Health Awareness Day. Great.
Thank you. It's been a pleasure.
Thank you.